Welcome, everyone, to this side event on MHPSS in Mine Action. We appreciate you attending this side event from wherever you're dialing in to discuss the significance of mental health and psychosocial support and well-being. I had obviously hoped that I could be able to welcome you all in person, and we're really saddened by the recent and worsening COVID situation in the Netherlands and worldwide, and as we were eager to welcome you all to The Hague and to discuss this important topic. Nevertheless, obviously in the past year and a half, we've been able to perfect our virtual skills. So I trust we will have a very interactive and inspiring discussion today with many eminent panelists and inspiring panelists. So we are joined by a number of experts in the field of mine action and MHPSS. I'm delighted to introduce them to you, and I'm sure that we will all leave the session energized, inspired, and hopeful. We will start by discussing what is understood by mental health and psychosocial support and what role it can play in victim assistance within the framework of the Anti-Landmine Convention, and then we will address how to include mental health and psychosocial support in mine action. We were supposed to start with Alex, but Alex has some difficulty catching online, so we will start with basically the basics of mental health and psychosocial support. So mental health psychosocial support, MHPSS, as it's called, is many words. It's not an easy abbreviation, and it's understood in many different ways, also sometimes misunderstood. So therefore, a brief explanation on the basics of mental health and psychosocial support in emergencies will be given by Sarah Harrison. Sarah Harrison, floor is yours.
Thank you very much. Yeah, I'm Sarah Harrison. I work for the International Federation of Red Crescent Societies, and I'm speaking to you from Copenhagen, Denmark. Unfortunately, I couldn't be there in person to see you. The term mental health and psychosocial support is relatively new in the humanitarian sector. It actually came into existence in 2007, and it's actually a bridging of people that were working more in the mental health, the clinical, the medical side, and people working on psychosocial support, including psychological support, who are often found within social welfare ministries, but also includes community level workers and teachers as well as examples. So mental health and psychosocial support is a bridging of these different families, so to speak, and it means that it exists on a continuum. So at the very base level, 100% of the population after an emergency, including, for example, stepping on a landmine or an explosive remnants of war, need access to basic services and security. In addition to that, people will also need the support from their family and their community members as well. And for a lot of people, this is actually more than enough for them to rebuild, to adapt to their new situation, to manage their lives moving forward. However, for some people, they've suffered from additional distress or additional trauma in addition to physical traumatic injuries, and they need additional support, meaning more psychological care, more intensive focused type support. And for some still, that might go on to develop a mental health condition or might have had severe exposure. They would possibly need access to clinical mental health services, meaning, for example, from a clinical psychologist, or in some cases from a psychiatrist if medication's required. So when we talk about MHPSS, we talk about that whole spectrum of care and all of the services being provided in a holistic way. And within the victim assistance, part of the Anti-Landmine Convention, it's one of the core areas, one of the 6 core areas, and it's psychological and psychosocial support that should be provided to direct and indirect victims as well. I hand over back to you.
Thank you, Sarah. And I think we don't have Alex online yet. At least I don't see him. So maybe I can ask you a further question, Sarah, before we move on. So that, that you explained the basics of mental health and psychosocial support. And you're an expert in integrating mental health social support in emergencies. But could you explain more specifically what it can do for assistance to survivors of remnants of war, explosive remnants of war?
Yes, for sure. So as I said, it's one of the 6 core areas of victim assistance in itself, psychological and psychosocial support, which means that those services should be provided to victims of explosive remnants of war and other indirect victims, their family members, for example. And that is necessarily provided not just by mine action actors, but particularly by health ministries or healthcare actors, also by actors working with community outreach type projects, social welfare projects, and also in the education ministries as well. So it's a direct service that needs to be provided as one of the core areas, which is critical to get people to be able to cope with their new situation. For example, to be able to cope with possibly having an amputation or having a prosthetic limb or having some disfigurement as a result of an injury. An adaptation in terms of their well-being, but also to their new life circumstance. They might have difficulties in carrying out the work they were doing beforehand, and they might have to find new livelihood opportunities or new jobs. So it's important in terms of just that particular pillar, in terms of functioning of a person and well-being, their own happiness levels, their ability to get up every day, to go about their daily lives and to interact with their family and be a positive member in their community. But crucially, a person's well-being is very instrumental to all the other areas of victim assistance. So if a person is very, very depressed or is very isolated and feels ashamed, for example, of their injury, it's very difficult for them to go out and to be able to access social support from their family and from their friends and from other community members, because they're too sad, they're too depressed, they're too isolated to be able to do it. In order for them to be able to rebuild a livelihood, again, it means that that person has to have a certain level of functioning. They have to be able to hold down a job and to be able to live productively and support their families again. And they can do that providing they have their well-being taken care of as well. So it's not just as its own pillar, it also interacts with all the other areas of victim assistance as well. And the most powerful providers of that support are certainly from the family, if you have a supportive family around you, but also if you've had peers or others who have suffered from the same exposure, for example, to an explosive remnant of war, and that person can help guide you, can act as a mentor, can lead support groups, can be your peer. We find that that's quite a powerful intervention in itself. It's relatively low cost, and it's also something that's incredibly decentralized. It doesn't rely on there being a physical government service or infrastructure in place, like a health clinic. It actually requires more the social connections at a community level. So it can also be provided in particularly rural areas or hard to access areas in a humanitarian context because of maybe a conflict or because it's particularly in an area that hasn't been cleared yet from mines. And I think from a mine actor perspective, mine actors' activities from a clearance and the mine risk education is also enormously reassuring for communities. It provides them with that sense of safety and that feeling of protection. And that's very instrumental. It obviously has an impact on a person's well-being. You can't feel a positive sense of well-being if you are unsafe. If you are scared because you don't know where there are mines on your land or in your community or on your way to school. So knowing how to protect yourself from landmines and other explosive remnants of war and seeing people actively clearing minefields is also a very powerful safety and support mechanism for communities as well. And then just lastly, another type of intervention that's integrated is also where we see rehabilitation workers working alongside what we call psychosocial workers, or people that have a psychology background or a social work background, and they're able to do home visits to people in communities that have suffered from an explosive remnants of war, and they're able to provide that support within a home and it's a mixture of a healthcare, rehabilitation, and psychosocial support, decentralized, provided at home, and in a way that's less stigmatizing and is more accessible for a survivor or for a victim as well. I think that's it. I've spoken enough. I'll hand over back to you now. Thank you.
Thank you so much, Sarah. And that's really, interesting. And listening to you makes me realize that it's not that complicated. I mean, from a human-to-human perspective, we can, I think, all relate to the examples you give, and what MHPSS can do, how important it is. It's important to all of us, but particularly in very stressful and dangerous circumstances. And you made that very clear. So the other leg that we wanted to discuss here is obviously then how to apply that specifically to mine action and how to integrate that. And so I would like to ask Firos, who is here with us, who is the implementation support officer at the Implementation Support Unit in Geneva, to explain how, the framework that governs. Oh, Alex is here. Shall we maybe first?
Sure.
Yeah? Alex, welcome. Happy you could make it.
I'm finally here.
Thank you.
Thank you so much. I'm sorry, network failed me.
And we lost you again. Alex, what we do, just to be sure, I ask, oh, here you are again. Shall we just try, Alex, because you are, amongst many things, you're also a survivor and very close to where the action is. So we would be really interested to listen to your story on what the importance of mental health and psychosocial support and what it can do for victims' assistance from your experience.
Okay. Oh, yeah. First of all, my apologies. The technology was failing me. As you've said, among other things, I'm a survivor, and I must say that the experience of surviving a landmine and living with the injuries that come with it have not been easier. And as we all know, mental health is not only important to survivors, but rather to everyone else, as research has clearly showed it that in the world we live in, at least one of every 4 persons is likely to have to face a mental health concern in their lifetime. But this is very, very intensified by the traumatic changes brought about by violent conflicts, which where indiscriminate weapons such as landmines, cluster munitions, and other explosive remnants of war are used. And as a result, many people have lost lives, families have lost loved ones, people have lost their limbs. These have led to very many different disabilities. And as a survivor, as unfortunate to have been in a place where mental health among like traumatic incidences in the hospitals is not taken as priority, where only what is done is giving you the medical treatment you require, patch up your wounds, and as soon as you're healed, you're sent home. And then you have to deal with the PTSD on your own. So having gone through that, I realized that it's very hard to move on from this stage where you have been injured to again living like the new life that you're supposed to live if you're not given proper mental, psychological, and emotional support. So I had to live with that. It was very hard. It took me nearly 9 years took me nearly 9 years to be able to consider myself as someone who is actually restoring my mental health. So you can imagine and we have different mental strength, different people will react in different ways. So to me, what helped me was discovering that actually sharing what I went through and what I have been able to endure to try and achieve something with my life after having suffered from that is what helped me to start recovering from this. So from that point, I realized that actually peer support and psychosocial support from other individuals who have gone through the same experience can be of too much help. And that's how I ended up getting involved in helping other survivors, providing them with peer support and psychosocial support. None of us in the group is a mental health expert as we work, but we use our lived experiences to try and motivate these other survivors, to try and help them feel what I felt when I started recovering from mental health. It felt like a new rebirth. It felt like I was starting to live again. But from the point I got injured to around 9 years, I didn't feel like I was actually living. Everything changed after that. So it is very, very important that we put mental health and psychosocial support at the forefront of achieving this pillar of mine action, being victim assistance. Because without the restoration of mental health, psychological health, and emotional health of the survivors, then we are likely not to be able to fully achieve the objective of victim assistance as it is. I think that's what I have to say for now about that.
Thank you so much, Alex. And first and foremost, my apologies, because I do recognize you're calling in from Uganda, and we all obviously heard about the news, the terrible news about the explosions today in Kampala. So it's good to see you're safe, but it must be increasingly stressful. So thank you for being with us, and our thoughts are with you and your people and the survivors. And also thank you for your testimony, Alex, because I think you really clearly, expressed that for your survival and regaining your life, that doesn't only depend on physical survival, but just as much on your mental strength and well-being and recovery and the long journey that you had, although I think 9 years is nothing. And so that is really a testimony, I think, of great strength. So thanks for sharing that. And also the work you're doing with other survivors. As you said, you're not experts, but it helps to be amongst peers and to learn from each other. Is there, just one question I would have for you at this stage, from your experience, what do you think, what should be done more actually to enhance support for survivors?
I think we need to start involving survivors more in these structures. As we plan for them, we need to involve them more. We need to give them the training that is required, because in my experience, I've realized even when you go to a rehabilitation center, the leg centers where we get prosthetics, it's easier for me to get there and I find someone who is being rehabilitated physically, and I talk to them. Well, once I talk to them, because they see I have lived it, usually they listen. So is the mental health provision services. I think we need to skill the survivors. We need to work with the survivor organizations and ensure that we plan with them, because the survivors know better what is required to help them get reintegrated into the communities.
Thank you. That is such an important matter, I think. You know, when we talk about sort of supporting the agency of people, obviously to start the people that survived what they need in order to regain their agency and their lives. I think that's a critical thing. And it's also, I think, a nice bridge to Firos, to explain the frameworks in which we work on mine action, but also the possibilities that we have to better integrate mental health and psychosocial support into those frameworks and efforts. Firos.
Thank you very much. Really appreciate and thank the Netherlands for holding this important side event. And thank you, Madam Director, for this opportunity. I was very happy that Alex made it before me because you said it all and very well. As well as Sarah, I think you made my job much easier. Just say a few words about the where MHPSS falls within the framework of the Anti-Personal Mine Ban Convention. And again, I think most of the participants today, excuse me, are well familiar with the convention. That one of the core objective of the convention is to prevent any harm and casualties that have landmines caused to people and the communities. But it also includes a provision that protects and promotes the rights and needs of landmine victims. And I think here, and usually I mention this, and perhaps it's quite repetitive for a lot of you, that it's quite important to remember who are the victims. In the definition that's and that has been developed over the past 2 decades is the victims. That term victims includes not only the landmine survivors, but also the affected families and communities. And this is particularly important to remember when we put this into the MHPSS context. I think both Sarah and Alex mentioned that the victim assistance is known as a group of activities, or 6 pillars as we call it, which starts with data collection to psychosocial support, rehabilitation, socioeconomic inclusion, then the implementation support mechanism, which is about laws, policies, guidelines, standards, and so on. Psychological support has been one of the very important pillars of victim assistance, and this discussion has started actually 20 years ago. Although over the years this has evolved quite a lot. In the past 4 action plans of the convention, psychological support, peer support has been one of the commitment, one of the pillars of victim assistance that has always been in the core of victim assistance. The current action plan, which is the Oslo action plan, is also includes a commitment on psychological support, peer support, which is basically a subset of broader MHPSS. So I think that the framework is there. There are a lot of standards, guidelines, and Sarah probably will have a chance to even give us more information about all the resources that are available for mine action community and for practitioners, for service providers to enhance their efforts in relation to MHPSS. I think, Alex, again, I really like and congratulate your work. What you do is really important, is that people to people on a peer support. With that, you don't have to be a professional trained counselor, although that's obviously needed, but you can make a big difference. I mean, I also personally have, a first-hand experience, and I can attest that surviving an accident does not necessarily mean that you would be able to survive the consequence of an accident, unfortunately. There are so many barriers, there are so many challenges that pressure you to stay home, that would pressure you to get isolated, that would pressure you to not be an active member of the society, that would force you to leave your job, your employment, because as Alex said, if you're not in a position to accept your situation, and I guess this applies to not only survivors, but many people, then that would be really hard to cope with the situation. And there, again, the role of psychological support, MHPSAs as a whole, is really, really critical. Although when it comes to practically, I mean, I have had the pleasure of interacting and working with a lot of affected communities. The first thing normally they would ask you is for employment, income generating, for something to survive. But then, there would be a gap if there's not a psychological support provided, in addition to all other supports. I think what you said, Sarah, that to have this holistic approach. The Committee on Victim Assistance hosted a victim assistance expert meeting last week on 10 November, and one of the MHPSS was featured as one of the 3 sessions of the victim assistance expert meeting. We had colleagues from WHO, from Handicap Humanity Inclusion, and from Tajikistan, who, in particular, I like to repeat what our colleague from Tajikistan, Dr. Raihana, probably she's listening, said that psychological support has to be seen as something that is related to many fields, many different policies and frameworks. So, and this has to be considered as a cross-cutting issue in not only mine action, but also in development, in education, in various other activities. And perhaps our colleague from HI will also elaborate on that. And I think what also makes MHPSAs even more relevant is the current situation that is caused, unfortunately, due to the COVID pandemic. And I think that that only this demonstrates how critical the nature of mental health is. That has been, as we've been receiving reports, that unfortunately COVID-19 pandemic has disproportionately impacting the lives of persons with disabilities, including mine survivors. And I think I'm so pleased that we are discussing this important matter, and hopefully this would lead to a better understanding and an increased and enhanced awareness. Thank you, Madam.
Thank you, Firoz. So the reasons for mental health and psychosocial support as an integral part of mine action are abound, and the legal and policy framework exists. So, but for many years still, and not only because of lack of funding, but questions about who's responsible for what in the field of victim assistance have hampered action. So now, as Firoz said, in last October, an international mine action standard has been developed and adopted on victim assistance in mine action. IMAS 13.10 is the code name. So we will now discuss the importance of this standard and how it may be used to promote mental health, psychosocial support, inclusive victim assistance. And with us is Bahar Aksim, MHPSS expert of humanity and inclusion, working in Iraq. Bahar, can you share with us, given your experience in the field, why this IMAS 13-10 is opening new perspectives for victim assistance, including MHPSS?
Yes, sure. Thank you very much. And I think everybody already made my job much easier because we heard a lot from Sarah, from Alex and Firoz. Thank you very much. So basically, as explained by Firoz, the Oslo Action Plan contains the provisions of victim assistance. However, while it is clear the provisions of, for example, the survey and clearance should be realized by the mine action sector, it's less clear who is responsible for realizing the victim assistance the actions that outlined in the Oslo Action Plan. And I'm sure you may heard about integrated approach, which Sarah already mentioned, to the victim assistance, which refers to the fact that the victim assistance actually requires a two-pronged approach. So basically, one is the specific efforts that undertaken by the mine action sectors, and then the broader efforts by many other sectors, such as health, including mental health, of course, education, labor, and social welfare sectors. So basically, while the job of the health and education sector may have been clear to most of us, but the actual role of the mine action sector remained less clear. And as you mentioned already, this was changed the last month with the endorsement of the IMS 1310 at the highest level of United Nations, I guess, on 13th of October. And basically, so this standard provides us the guidance, basically provides the guidance to mine action sectors, like mine action authorities, centers, mine action operators, the survivor organizations on how it can contribute to facilitation of the access to the services for people injured by explosive ordnance, so for survivors and for other peoples who are in need. And basically, when implemented, IMS 1310 will ensure that the explosive ordnance risk education, survey and clearance, those activities will do their part in connecting people in need with MHPSS and other services through, for example, identification and referral of survivors and indirect victims, through raising awareness of MHPSS providers such as Ministry of Health, as well as survivors and also indirect victims on MHPSS. Basically, identification and referral of survivors and indirect victims to MHPSS and also other services, and to contribute to the development of the National Action Plan strategies on disability, on victim assistance, on health, or any other related ministerial strategies. And lastly, also the resource mobilization for MHPSS and other services. So as humanity and inclusion, we implement a comprehensive quality approach to mine action, basically implementing land release, explosive ordnance risk education, victim assistance, and advocacy in one and the same geographical area. So basically, this allows our teams involved in risk education and land release directly to liaise with the survivors and others in need. And in line with the IMS 1310, we are currently in the process of developing SOP, which will see our risk education agents and also land release staff to identify the survivors and indirect victims to the services, as well as our non-technical survey teams also collecting the information on services in the area as a part of their usual activities. And also, like in the words of this special reporter on disability during the opening ceremony yesterday, so basically, we can say like IMS 1310 paves the way to ensure the greater coherence and reducing fragmentation. So basically, recognizing the urgent need for MHPSS in many of the contexts in which HI work, we are also training our risk education agents in the psychological first aid. This is the case in many countries that we have the explosive ordnance risk education and mine action activities. So basically, like for example, we have a project called Safe Schools Project in Burkina Faso. And also we have the same projects in Libya, where we do not only train our staff, as well as we train the mine action, like other mine action professionals from other organizations. And we do also this in Iraq, but I will share it later. Thank you very much.
Thank you, Bahar. And I think it's really clear that this new International Mine Action Standard, I try to memorize this and stay away from the acronym, that it will be guiding and facilitating both mine actors themselves, but also the interaction with other regular national actors and authorities. And you mentioned the integrated approach, the need, to reach out to others, to other players and other stakeholders. And I think a few days ago, victims in the victim assistance expert meeting, a colleague of yours, Bahar, from Colombia, made that point very eloquently, the need to reach out to other stakeholders. So from your experience and your work in Iraq, How do you do that? How do you manage to get others to join? And also, how do you whip up financial support as well as political support for the work you're doing?
Yeah. So basically, the existence of the Mine Ban Treaty and the recognition of the need for victim assistance and also for MHPSS in particular, we already mentioned, like, the Oslo Action Plan has provided some, although far from sufficient, financial support from the mine action actors for the victim assistance. So basically, this has enabled HI, a multi-mandated organization, basically engaged in clearance, risk education, advocacy, in victim assistance in order to address mental health issues that are faced by explosive ordnance survivors, families of people injured and killed, and any other affected communities. And the need for this type of support here in Iraq is really tremendous. An estimated 18.6, I'm very bad with the numbers, sorry. 18.6% of the population, meaning like almost 6 million people, suffer from mental health condition. And basically, WHO estimates that the mental health conditions in the in the country is the fourth leading cause of poor health for Iraqis over the age of 5. So basically, this high rate of mental health conditions is a result of trauma from years of violence and ongoing political and security instability, and as well as widespread presence of explosive ordnances. So basically, during the past 40 years, Iraqis have been faced with near constant conflict, including an 8-year Iran-Iraq war, 2 Gulf Wars, decades of economic sanctions, authoritarianism, a civil war, and the recent occupation by the Islamic State of Iraq and Syria group, as well as the global pandemic as any other country. So basically, generations of Iraqis exposed to recurrent conflicts and the global pandemic, they need to regain their emotional safety. And we believe that an important avenue through which we can achieve this is the true provision of MHPSS. However, the availability and the quality of the mental health care in Iraq is far scarce than the existing needs. And the majority of the Iraqi people that HI work with, they have experienced distressing and traumatic events that have resulted debilitating levels of reduced self-esteem, permanent or lifelong disability, depression, feeling of insecurity, social withdrawal, self-harm, and suicide. And basically, people are telling us the feeling of insecurity is not only because of the contamination, but as well as because of all this recurrent conflict. So that's why they really need to regain their emotional safety. And however, the trauma also is deeply stigmatized in many other countries. And people, basically, they often being afraid or unable to access the needed support. And our risk education agents and also the land release teams, basically, they are reducing the barriers to accessing MHPSS services, meaning the difference between life and death for a person facing a severe mental trauma. Because, I mean, MHPSS services are not a luxury, but instead life-saving and life-changing. However, the stigmatization of mental health issues still remains one of the biggest barriers to accessing MHPSS services. And to further overcome with this issue, we believe that the integration of MHPSS into other sectors, including humanitarian mine action, but also into other sectors, is crucial, and it's also a key to fighting with stigma that is related to mental health. As Sarah mentioned about one way of integrated approach is the physical rehabilitation. So basically, we do implement this integrated physical and functional rehabilitation along with MHPSS services. And thanks to this approach, which identifies the multiple needs of the people may have, and we have witnessed basically, they told us before they were not able to identify the mental health needs they have. But with the integrated approach, now they are more able to identify their mental health needs along with their physical rehabilitation needs. And so that they are more freely speaking out about mental health needs than before. So thereby beginning to break the vicious cycle of silent suffering that the lack of MHPSS services in the face of overwhelming with mental health needs creates. And I just want to give you a concrete example from the field about how MHPSS services can make a difference in the lives of the conflict-affected people in Iraq. So basically, HRAC supported a family of a victim of an explosive ordnance accident who had been identified by our risk education staff team and then received initial psychological first aid. We then facilitated survivors' access to our MHPSS staff, basically also lifting an important barrier of lack of information on available services. The family then was supported through follow-up MHPSS sessions. So basically people who received those services, they expressed that they didn't really believe in MHPSS services because it's kind of a tradition here, you know, when you go to provide something, it's kind of a, how to say, like they are not able to tell you no, but it's just how to say, it's a traditional, you know, like they will accept you, but basically they don't really believe in what you are doing. But basically what they told us, like they didn't believe in what we were doing, but then they felt, they expressed the feeling of reassured, knowing that there were people to support them if needed. Like meaning just being there for them is increasing the perception of emotional safety. So basically, I mean, just to end, MHPSS services are crucial in the delivery of the continuum of services. And yeah, thank you very much.
Thanks, Bahar. And I think that you make the point perfectly clear, isn't it, that MHPS has to be part of an integrated approach to victim assistance, but also it's a good platform, basically, for reaching out to other stakeholders, as it is something that we have in common. And trust me, a taboo on saying that, I don't need mental health or psychosocial support is a universal value or a universal shared concern. So I think it's also something that many people can relate to. So thank you for that. And I was wondering, Firoz, in your experience, so how will then IMS 1310 indeed help the different stakeholders to increase cooperation and complementarity? And what would be your advice to state parties as to the way they can make use of and promote the application of IMS 1310?
Thank you very much. I think IMS 1310, or Victim Assistance IMS, as we call it now,
that's a better one.
Is a
away from the numbers.
Progress, yes. As Bahar said, I think what IMS 1310 is unique in terms of, in comparison to all other IMSs that exist for mine action, that this one is providing clarity on roles and responsibilities of mine action in victim assistance versus all other sectors, all different domains like health, education, development, poverty reduction, and so on. And that, I think, that kind of make it easier, the complexity of victim assistance. Victim assistance is a complex issue, especially when it's put next to clearance, stockpile distraction, survey, and risk education. Because in clearance and all of other areas of the convention, you have a start and an end, whereas in victim assistance, it is a process. It is a process, a complicated one, a cross-cutting process. And I think for that reason, what IMAS does is providing that set of roles and responsibilities for national mine action authorities, international organizations, the operators, and the organizations of mine survivors. Which I think this would, this is a fairly brand new, standard. It's a standard. It's a document. If it's not used, it would not obviously make a difference. But we are, as the Committee on Victim Assistance put it in its report and preliminary observations at the intersessional as well, there is a good pattern that can be seen in a lot of the state parties to the convention that have been taking increasingly an integrated approach, which is a good good development in terms of sustaining the assistance that is provided to mine victims by integrating different elements of victim assistance into different national policies and programs as they find it relevant. A couple of examples of that pattern could be around integrating the issues that are related to healthcare of mine victims into health policies and programs. Integrating the issue of accessibility into national standards on accessibility code of buildings, public buildings. Or it could be about the curriculum of schools. In some of the countries, you see that the awareness about risk education or even awareness about the rights of persons with disabilities, including mine survivors, are being integrated into more skill curriculum, which is quite important. And there's a lot of other examples of positive development in terms of sharing that responsibility of victim assistance, because as we know, mine action centers are not permanent. They are established with a specific mandate, and when the mine clearance is over, normally this responsibility, whatever little responsibility is left, that would be shifted to Ministry of Defense or Ministry of Interior to deal with the residual problem of any explosive remnants of war that will be left out of mine clearance. So for that reason, it's so important to ensure that victim assistance is integrated into relevant national policies and programs, into national implementation mechanisms, so that before the mine action centers are closed, there is somebody else already feeling in charge of victim assistance coordination, data collection, all aspects of victim assistance. And I think that's one of the challenge, and I think that's where the IMAS 1310, but also a lot of national mine action strategy, national disability plan, victim assistance plans, they're all taking this approach to be more inclusive and to share this responsibility with mostly Ministry of Health, Ministry of Social Welfare, but also National Council of Persons with Disabilities and other relevant national authorities. I think these are quite welcome progress, and there's a lot of other developments like the UN Council, UN Security Council resolution that was in 2019 on protection and promotion of the rights of persons with disability, including mine survivors in situation of armed conflict. These all can contribute to what we talked today here about providing and strengthening that mental health and psychological support aspects of victim assistance.
Thank you, Firoz. And so the standards really help to or provide practical tools on how to share that responsibility for victims' assistance, or as was said yesterday at the opening, survivor rights, to move from victim assistance to survivor rights. And that brings me back to you, Alex, just, before we open it to the floor, to the audience, but you having listened to the other experts, what would be your main advice to them and to the state parties to the convention that are listening?
I think it's very important that the state parties ensure that their mental health and physical rehabilitation facilities in place, which are accessible to all survivors. That is one. And two, because like before, as I was preparing for this event, I had a questionnaire I prepared, and I went through a few survivors and was asking them a few questions in regards to what they think of what peer support has done for them and psychosocial support, and how it has helped them to regain their confidence, regain their strength to get into the communities. But the question that kept on reappearing and reappearing was that, yes, I've been rehabilitated. I now have an artificial leg, but I lost my job. What should I do? So I think if the state parties and the donor community can work with the survivor organizations and see how best they can equip these survivors with skills that can help them survive in the communities. That would be very helpful. And then, as I said earlier, survivors should be involved in the implementing of victim assistance, even when it is being implemented at the national level. As we are saying, all this and the rights of disabilities should be integrated in the government programs. Like Firoz said, the health needs of survivors are continuous. You lose a leg, you have lost it. You're going to need prosthetics from that point until when you leave this world. And these equipments are expensive, and some governments don't have these programs in place. I'm saying this on behalf of Uganda. We don't have programs that provide affordable prosthetics. That would also be a very good thing. And then also, as the state parties try to implement victim assistance, they should consult with survivor organizations to see how best these programs can be implemented, since the programs are actually meant for them. And then in my experience, like the physical rehabilitation centers, I think we are already pushing it for it here in Uganda. There is an assistive technology conference next weekend where I will be giving a keynote speech. And one of the things I'm advocating for is to ensure that, as I said earlier, that if we can train the survivors into acquiring, let's say, counseling in a professional level, and then rehabilitation centers like the private ones we have in Uganda, they give these people jobs to ensure that once someone goes for rehabilitation, they are actually someone who knows how it feels like to use a prosthetic limb. Because I've realized it starts with your mental restoration to be able to be physical rehabilitation, leave alone be reintegrated into the communities. Thank you so much.
Thank you, Alex, for that. We are coming close to the end, but there is the opportunity for the heads of delegation to ask questions to one of the panelists. So you can use the raise hand tools, and if it doesn't work, just open your mic to ask your question. And so far, I haven't seen any hand of those that are in the legislate platform. So I give you a bit more time to raise your hand. Meanwhile, maybe for everybody who's listening and to this conversation, if you would like to know more about what mental health psychosocial support entails and what it can do, there's also a few networks that you can join. So there's the mhpss.net. Network, and there's the Interagency Standing Committee Mental Health Psychosocial Support Reference Group with a host of materials as well, if you would like to better understand. And obviously, we had the experts in this panel, who I'm sure are happy to engage if you have very specific questions, or who can refer you to experts that can help you with integrating mental health and psychosocial support in Mind Action. I think we have no questions from the audience. And that may mean that we can close and wrap up this very rich discussion. And I'll try to summarize, but obviously that never does justice to the rich experience that was shared. But let me give it a try. So we heard clearly how MHPSS can contribute to rehabilitation of survivors and their relatives, their beloved ones. How not only the body, but also the mind deserves attention from the very start of any effort to help victims and survivors to recover, regain their life, and rebuild their existence. So I think the examples provided by Alex from ASNU and Bahar from the Humanity and Inclusion Operations show how MHPSS interventions can strengthen resilience and agency, and how mental and psychosocial needs can and may not be ignored, or victim assistance and rehabilitation will be less effective or without effect at all. And I wish to also mention the effect on people, on communities, of having to live to ensure livelihood and not yet cleared surroundings. The constant stress and anxiety and tensions this must entail, of which the psychosocial consequences also should not be ignored. And we also heard that it is possible and smart and feasible to integrate mental health and psychosocial support in mine action, in victim assistance, as it is feasible to do so in health and education and social sector policies. And too often, MHPSS seems not only a complicated acronym, but also a highly complex sphere of work, for which highly specialized staff is needed at large scale. And I think Bahar and Alex clearly demonstrated that that is not the case. And even if it is complex, complexity can never be an excuse for inaction. So the examples shared today show the possibility to include MHPSS in broader programs, starting with relatively simple, community-based, non-medical, basic psychosocial actions. And at the same time, the various examples also show that in order to enable implementing organizations and actors to include MHPSS in their work, explicit recognition is needed at the policy level among those who decide on strategies and budgets at national and international level. Mental ill health suffers from stigma, and it's hard to openly discuss for many. Explicit global policy efforts and high-level advocacy are crucial to enable the structural integration of MHPSS in humanitarian and development response on the ground. And that is why we as the Netherlands have prioritized advocacy for and facilitation of integration of MHPSS in emergency response, in conflict prevention, in building and sustaining peace, as well as in mine action. And beyond those spheres of work, in development strategies for health, for education, for social protection, and this could be continued. MHPSS is recognized as a cross-sectoral issue and responsibility, a shared responsibility, by the principles of the Interagency Standing Committee that I referred to just before. So the Netherlands sees MHPSS really as a shared responsibility across the so-called humanitarian development peace nexus. And we see the importance of learning lessons across the different sectors. So we encourage partners on MHPSS to make use of the experience with the integration of MHPSS within the humanitarian sector and of guidance materials developed by the Interagency Standing Committee MHPSS Reference Group, and I referred to that already. It's related to humanitarian assistance, but obviously of tremendous value for all the other work around the triple nexus of development, humanitarian, and peace building. But also, as I said, to make use of the colleagues and the experience of the colleagues across the world. That's also important because do no harm is a core principle for any intervention, and especially for psychosocial support. This principle needs to be safeguarded by quality standards, and we have one in Mine Action, by training, as many of you do, and by sufficient strategic patience. Because we have to recognize that many psychosocial processes do need time. And by political and diplomatic understanding and support at all levels for MHPSS as integral part of rehabilitation efforts within within as well as beyond national mine action plans. So we heard that IMAS 1310, or victim assistance IMAS, is important because it defines roles and responsibilities, and because it provides guidance to the professionals and officials that have those different roles and responsibilities, and how to ensure effective cooperation between mine action and regular healthcare, education, and other social sectors, on how to join forces and ensure a continuity of care. The Netherlands will continue its advocacy for structurally including MHPSS in relevant strategies, interventions, and budgets, including in mine action and victim assistance strategies. This should not be a separately funded field of work, but an integral part of any rehabilitation mandate, approach, and funding. So we invite national authorities and all stakeholders involved to join these efforts. As said earlier by several speakers in this panel, we only can do this together. So I would like to thank all panelists and all those who have joined this interesting panel, this side event. Let's stay in touch, let's learn from each other, and make sure that mental health and psychosocial support is no longer an afterthought, but really the starting point and the core of our cooperation on mine action. Thank you very much.